This is part 2 in how to reduce the chance of tearing during birth. So what is perineal massage and should you consider it? So as a starting point, perineal massage involves massaging the perineal skin and perineal muscle during pregnancy. And for those who are having their first baby, it potentially reduces the chance of tearing during birth. As with anything though, it's up to the individual woman or person as to what they want to do. You do not have to do this, and there are other ways to reduce the chance of tearing in video 1 that you can go and check out. Perineal massage is a technique that you would do yourself at home, and it's used to prepare the perineum. So the perineum is the part here in between your vagina and your anus. This is the skin and muscles. This is where tearing is most likely to happen during childbirth. It's the most common form of tearing. So I want you to try this on yourself at home right now throughout this video. So put your hands together and stretch your thumbs as far as you can from your index finger. Hopefully they are the same distance from each other on both hands. And now what I want you to do throughout this video is firmly massage the skin in between your thumb and index finger whilst I talk about all the benefits of perineal massage. So for those who are having their first baby, perineal massage reduced episiotomy and there was a small reduction in tearing requiring stitches overall. The number needed to treat is 15. So for every 15 women and people having their first baby who did perineal massage, the chances of tearing needing stitches reduced by 1. And the number needed to treat for reducing the chance of episiotomy was 21. So for every 21 women and people having their first baby who did antenatal perineal massage, 1 less person would have an episiotomy. And whilst there was no difference seen in women and people having their second, third, fourth, etc. baby in tearing chance or needing stitches, people who did antenatal massage during their pregnancy reported less perineal pain after birth. So in the Cochrane review, Beckman and Stock state that antenatal perineal massage reduces the likelihood of perineal trauma, mainly episiotomies for first-time mums, and the reporting of ongoing perineal pain in second plus time mums, and it's generally well accepted by women. As such, women and people should be made aware of the likely benefits of perineal massage and provided with information on how to do antenatal massage during their pregnancy. And the possible reasons for these benefits are possibly helping the elasticality of the skin and the muscles through regularly massaging and improving the blood circulation to the area. There's also another element of improved and perceived control regarding birth, as it is something that you can do ahead of time and something that you can prepare for to help hopefully stack the odds in your favour and reduce the chance of tearing. People who do antenatal massage are also more likely to go and explore other ways to reduce the chance of tearing, which you can see in video 1 on my page. Now, one of the other benefits of doing perineal massage in your pregnancy is that it connects your mind to your perineum, and some of the gentle stretching sensations that you're doing as part of that perineal massage can help with that pushing stage. So with most women and people, when they reach that pushing stage, they will just really go for it and go, yes, I'm going to birth my baby. Go with those sensations, go with those reflexes, that fetal ejection reflex that happens, and they will continue pushing. But there are some women and people who freak out a little bit and find it quite scary at the point where they can start to feel that head coming down into the vagina, placing that pressure on their bum and on their perineal muscles. And the people who do perineal massage, because they've already been doing that sensation, that gentle stretching sensation, what happens is actually they push more effectively. They don't worry. They don't actually feel that anxiety quite so much because they know what's happening to their body. They've already made those connections in pregnancy that when it happens, they go, okay, I'm very close now. I can feel my baby's head starting to crank. Great, I'm almost there. I'm about to meet my baby. So that mind-body connection can make a big difference during pregnancy, and it can just help reducing that oh my God, freak out sort of moment. I actually don't want to do this anymore. I'm going to just squeeze and hold my baby in, which happens very occasionally. And just FYI, this is where continuity is its finest, because if you've got that trusting relationship with your midwife, they are the ones who are going to hold your hand through that. You're going to feel more trusting of your midwife, and that temporary, oh my God, what am I doing, will disappear. So this is where continuity is at its finest, and where a doula could be fantastic as well. So what are some of the downsides or risks? Well, discomfort and pain, especially if you don't do it gently. It's all about that gentle stretch. Infection risk is also there as well. So really important that if you do any perineal massage, that you wash your hands before and afterwards with doing it. And if you're getting your partner involved, make sure that they wash their hands before and afterwards to reduce the chance of infection. And by the way, this is a theoretical risk of infection. There is no evidence or research to say that doing perineal massage has any difference on infection rates overall. So hopefully you've been massaging this part here on your hand throughout this video. This is my ring hand that I have been massaging throughout. If I now place my fingers back together, I can stretch this thumb much further, my ring finger, then I can, on the other hand, I can't stretch that anymore. And that's because of all the massage that I've been doing. In the next video, I will go through how to do perineal massage, how frequently you should do it from the research and evidence base that exists out there. And this just highlights the benefits of massage. Massage is fantastic for lots of different things, but this is where antenatal perineal massage really comes into its own. Now, within this video, I have solely focused on the antenatal perineal massage, and that's because it's quite acceptable to women to be able to do themselves at home. However, I just want to add that there is some more evidence building for in labour during the pushing stage of doing some perineal massage from a midwife or a doctor at increasing the chance of having an intact perineum, so no stitches at all. Now, this is small bodies of evidence at the moment. It's not routine practice. It is not something that we have enough evidence to make those recommendations about at the moment. There are also other risks in terms of infection. Someone else is doing this for you. It's not the same as if you were at home doing this during the antenatal period. And also the added pain and discomfort during that crowning stage, especially if you haven't got an epidural on board. But this is something that as the research and evidence builds, we may see a change to practice, but we will wait and see. At the moment, this is not standard practice. This is something that would also require your fully informed consent, going through all the risks and all the benefits before a midwife or a doctor would do any perineal massage. And you can say no, it shouldn't be done routinely, and it absolutely shouldn't be done without your consent.